How much does failed implant revision cost in Turkey?
One of the first questions patients ask is about the cost of revision treatment. The answer depends entirely on the reason for failure. Some cases only require non-surgical treatment, while others may involve implant removal, bone grafting, and replacement. That's why a proper assessment and a CBCT scan are always the first step.
Can every failed implant be saved?
No, unfortunately, not every failed implant can be saved. If the problem is identified early, some implants can be treated and preserved. However, advanced cases with significant bone loss often require implant removal and replacement.
How long does revision treatment take from start to finish?
Revision treatment is usually a process rather than a single procedure. Depending on the condition of the bone and surrounding tissues, treatment can take several months, especially if bone grafting or implant replacement is required.
Is revision treatment painful?
Most patients are surprised to learn that revision treatment is very similar to the original implant procedure. We use local anesthesia, and for anxious patients, sedation options are available. Any discomfort afterward is usually manageable with routine medications.
Can my small revision be handled at the London clinic instead of Antalya?
In many cases, yes. Diagnostic assessments, routine monitoring, implant maintenance, crown adjustments, and non-surgical treatments can often be managed at our London clinic.
Should I get revision at the original clinic or somewhere new?
There isn't one correct answer. It depends on why the implant failed, the experience of the original clinic, and whether a specialist revision team may be better suited to manage the case. Every situation should be assessed individually.
What is peri-implantitis and how is it treated?
Peri-implantitis is one of the most common causes of implant failure. It's an infection around the implant that can lead to bone loss if left untreated. Early diagnosis is extremely important because treatment is much more predictable in the early stages.
Will I need bone grafting for my revision?
Not always, but many revision cases do require some level of bone reconstruction. A 3D CBCT scan allows us to evaluate the amount of bone available and determine whether grafting is necessary before placing a new implant.
Can I have IV sedation during revision surgery?
Absolutely. Many patients choose IV sedation, particularly for more complex revision procedures. It allows treatment to be carried out comfortably while reducing anxiety throughout the process.
What follow-up care is available in the UK?
Follow-up care is one of the most important aspects of revision treatment. Our UK clinic can provide monitoring, x-rays, hygiene reviews, maintenance appointments, and ongoing support without requiring frequent travel.
What if my revision also fails?
That's an understandable concern. The key to successful revision treatment is identifying why the original implant failed in the first place. Once the underlying cause is addressed, success rates are extremely high, and the risk of the second failure becomes significantly lower. If you've been told that your implant has failed, don't assume it cannot be fixed. Send us your x-rays or CBCT scan and we will assess all available treatment options.